Hello everyone. Welcome to the Can Wearables Support People with Arthritis to be Physically Active webinar. We're glad you're here with us today. My name is Tanya Hyde and I'll be moderating the webinar. I'm the project manager with the Canadian Institute for the Relief of Pain and Disability, and this webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to CIRPD. As I mentioned, my name is Tanya and I'll be moderating the webinar and handling the Q&A session. And our presenter today is Dr. Linda Lee. Dr. Lee is Associate Professor, Harold Robinson Arthritis Society Chair in Arthritic Diseases, and Canada Research Chair in Patient-Oriented Knowledge Translation at the Department of Physical Therapy at the University of British Columbia. She's also a senior scientist at the Arthritis Research Canada and is a Michael Smith Foundation for Health Research Scholar. Dr. Lee leads the Arthritis Joint Health and Knowledge Translation Research Program at ARC. As a health services researcher, her research focuses in three areas. One, understanding and the help-seeking experience in people with early inflammatory arthritis. Two, evaluating models of arthritis care. And three, studying the role of digital media tools for improving the uptake of effective treatment. Her work involves collaborating with scientists in sociology, health psychology, computer science, and visual arts to create online tools such as decision aids for promoting shared decision-making and interactive programs for coaching people to be physically active. Thank you very much for being with us today, Linda, and I will hand it over to you now.
Thank you, Tanya, and I want to take the opportunity to thank CIRPD for inviting me to give this presentation, and I want to welcome you all online or on the phone. Tanya, I just want to mention that if for some reason the screen freezes, because we actually had a power outage this morning for everyone who may be curious, just let me know and then we can switch over for you to control the slide.
Okay, that sounds good.
All right. So now I want to first of all declare a little bit about my conflict of interest, because in this presentation I'm going to talk a bit about the use of wearable, and we'll be mentioning names of companies and so on. So I just want to be clear that I don't have any conflict and financial interest in the devices and company that I'm mentioning. I also understand that most of you on the phone are health professionals, and a number of you are people living with chronic pain. So my presentation is geared toward primarily for these two populations, and hopefully you will find it useful. So what I would like to do in the next 40 minutes or so is to discuss three things. First of all, I want to talk a little bit about the readiness of using digital tools in arthritis care and in chronic disease management. I would then present a couple of examples of commercially available wearable devices for tracking physical activity, and the presentation will end with a discussion about issues related to the use of wearables and some of our future research directions. Now, just about 10 years ago, I think people would say that, well, you know, it is not a common thing that people would see their doctors or specialists online. But today there are actually companies, a number of companies available in Canada that offers seamless e-health platforms for people to see their doctors and specialists. In British Columbia, some of these services are actually covered by medical services plan. So anyone who's wondering whether e-health is going to be the future, I would like to suggest that e-health is actually here. It's the present. And indeed, we are in Canada are ready to embrace digital media as part of healthcare delivery. This is the information that came from the most recent Canadian Internet Use Survey, which was actually done in 2012. So I'd like you to think about it with in your mind that this is the number we're showing are probably even better than what it shows right here. So in 2012, more than 80% of Canadians had access to internet for personal use, and about 78% of the household had at least one cell phone. The fastest growing population for using internet are actually the older population, age 65 and over. At the time of the survey, 48% of them use internet regularly at home. 58% of the internet users have access to the web via a tablet or a cell phone, and more than 1 in 4 people use their cell phone to actually access health, fitness, and nutritional applications through their devices. So we are actually a very active population in terms of using digital medias in various devices and platforms to access health information. Now, when we're talking about e-health, I want to just pull us back a little bit about what we're actually talking about. E-health encompasses a large variety of interventions, anything from electronic medical record to telehealth to anything that support clinicians to make decisions when they're seeing patients, or for patients to seek information such as patient decision aid to healthcare informatics system. They're all under the umbrella of e-health. M-health or mobile health is one component of e-health, and it usually includes the use of mobile application and wearable devices to exchange and deliver health interventions for patient care. So M-health provide a very versatile platform for providing health services. One of the advantages of using wearable devices is that it can collect a lot of the information, minute-by-minute information, especially around people's physical activity. And a lot of these devices can be paired with mobile apps which allow people to get feedbacks about their performance at the time and at the place that they prefer. So they have tremendous opportunity, potential to help people to be physically active and for health professionals to deliver interventions. Mobile health, in addition to monitor physical activity levels, it also provides opportunities for screening and monitoring other vital signs like heart rate, blood pressure, and glucose level. And many of you know about that. So let's step back a little bit to talk about physical activity before we move on to talk about the devices. So as many of you already know, that physical activity is something that we do involve the whole body movement. So it's not just focusing on one joint or several groups of muscles, but it involves the whole body type of activities. So broadly speaking, it includes anything that we do recreationally in our job, so occupational activity is part of physical activity, as well as anything that we do in our daily life. Now, of course, exercise is a subset of physical activities, it's a component of physical activity, but it involves more specifically planned structure type of activity, and oftentimes it involves repetitive movement of a certain joint or the use of certain groups of muscles. And they're usually done for a specific purpose. It could be for people wanting to increase range of motion of their joint, increasing flexibility, muscle strength, or cardiovascular fitness. So exercise is a very specific group of physical activity. When we're talking about physical activity, we're talking about things that are much broader than just exercise alone. The Canadian Physical Activity Guideline, many of you are familiar with, recommend that in order to stay healthy, we need to accumulate 150 minutes of moderate to vigorous activity every week. So if you spread it over a week, it takes about 30 minutes most days of the week. And the current guideline also recommend that instead of recommending people to find 30-minute chunk of time to be active as a target, the 30 minutes can actually be spread across in 10-minute sessions. So which makes it more feasible for people to find ways and times to be active during the week. Moderate level of physical activity would be the type of things that people would do when they notice that there is an increase in heart rate and also feeling a little bit out of breath, but usually they can still carry out a conversation. When we talk about vigorous activity, the individual performing the activity will feel a substantial increase of their heart rate, and their breathing is usually a little bit, breathing rate was higher, so they will have problem carrying out a conversation. Now here's the issue. We all know about the physical activity guidelines, but certainly the uptake of being physically active has not been great. In the population that I am working with, people with arthritis, this is an even more important issue. The Canadian Community Health Survey in 2011 has already demonstrated that amongst people with arthritis, 57% of them would self-report that they were not physically active during their leisure time. And this was much higher as compared to 46% of people without arthritis who self-reported that they were not physically active. Another study that used accelerometer, which is an objective outcome measure of physical activity in people with rheumatoid arthritis, and the study was done in the United States, found that 42% of people with rheumatoid arthritis accumulated 0 minutes of moderate to vigorous activities that were done in bouts of 10 minutes, in a 10-minute session in a particular week. So we're talking about people are really, really not living an active lifestyle. The physical inactivity or sedentary lifestyle is becomes such an issue that there are global movements that are trying to increase awareness of the importance of exercise and physical activity, and also trying to change health professionals' practice in terms of addressing physical activity as a health issue. So in the Canadian Medical Association Journal several years ago published an article titled Exercise is Medicine. And what they were advertising along with a number of countries around the world is that the level of physical activity is really an important question that health professionals should ask every patient when they see them in the clinical practice. And it's also the health professional's responsibility to help people to work through some of the barriers and identify proper resources to help people engage in the physically active lifestyle. Now, in people with arthritis and chronic pain, I think we've talked a lot about staying active. You know, some of the activities such as exercising in a swimming pool, those are a type of exercise that people tend to enjoy. But what is equally important is to address the issue about sitting too much, sedentary behavior. Now, interestingly, now we have more research from a variety of chronic diseases that shows that sitting too much is an independent risk factor to one's health. Sedentary behavior is linked to a number of increased risk factor in a number of conditions. So in people with rheumatoid arthritis, for example, we know that people who sit too much during the day, their blood pressure tends to be higher, and the risk of cardiovascular diseases is also higher. It has also been shown that in people with rheumatoid arthritis, sitting too much is associated with a higher level of inflammatory markers found in their body. So again, certainly this is not a good thing for people with inflammatory conditions. And also, sedentary lifestyle is an independent risk factor of increasing the resting level blood sugar. What is interesting is that if we can shift some of the sitting time to doing light activity, it's actually a good thing. So light activity, what we're talking about is the kind of daily tasks that are done in standing or slow walking. There's emerging evidence suggesting that light activity alone can produce health benefits that are independent of the amount of moderate to vigorous level activities done by the person. And it also decreases the cardiometabolic biomarkers in people with chronic diseases. The bottom line is that if we encourage people to exercise or be physically active, and to meet the physical activity guideline of 115 minutes, and they do that, but at the same time, if they sit all day, that is still going to be bad for their health. So I think what is important is that we need to think about modifying sedentary behavior as a separate conversation as encouraging people to be physically active. What I'd like to show you is sort of the changes of physical activity, sedentary behavior, and how it actually happen in real life. So this diagram here shows a study where they have 1,700 people wearing an accelerometer for a 1-week period. And from going from left to right, it shows people who are the least sedentary to the most sedentary. So the dark in each of the column at the bottom, it shows the number of hours of people spend in sedentary behavior during the time they're awake. On top of that is the amount of time that's spent in light activity, and at the very top is the amount of time people spend in moderate to vigorous activity. People who are the least sedentary group, on average, spend about 6 hours per day sitting, versus the most sedentary group, they spend about 10 hours a day sitting. That's a lot of time. But what is interesting is that if you see, when you look at the spread of sedentary time, when the sedentary time decreases across the groups, the time is not shifted for doing more moderate to vigorous activity, but rather people are doing more light activity. So again, that supports the idea that when we are talking to patients about being less sedentary, the conversation needs to focus on not only meeting the physical activity guideline, but also to talk about strategies for them to sit less and move more, and shifting to the area of doing more light activity, which has an independent effect for their general health. Now let's talk a little bit about why people are not physically active, because I think that links directly to why using wearable devices and using digital media could be potentially helpful for patients. In the literature, we know that there are several modifiable factors that are associated with low physical activity participation. People say that they don't have time, or they're not motivated to be active, or in some people, they simply did not realize that being active is an effective way to maintain good health for people with arthritis. And of course, some people may have started being active and then they stop because they don't have advice from the health professional, especially when the pain increases or when the symptom changes over time. People wonder whether they should continue to stay active or not, and lacking that health professional advice was one of the reasons why people stop being physically active. There are several ways that we know, again, from research that can help to increase people's interest or participation in being physically active. First and foremost, making sure that the activity is fun and enjoyable is helpful. So that is the reason why as health professionals, I know many of you would ask your patients to perhaps put on some music when you're going out for a walk and or when you're exercising. Using video games, so Connect or WeFit, those sort of programs are quite popular in helping people to exercise while having fun. Other ways to increase people's participation in physical activity, especially in chronic bone and joint diseases, evidence from one of the Cochrane reviews suggests that self-management program can be helpful for people to learn skills and knowledge to be able to manage their symptoms while trying to be physically active without causing any additional discomfort is quite effective. Other strategies would include graded exercise activities, such as starting the exercise program, targeting simpler exercise in areas that are least painful, and then progressively increase the intensity of the exercise is important. And also having refresher sessions are important. Now, many of these interventions will require the collaboration between patients and health professionals to make progress in the program and constant feedback about their performance. So then the question is, can technology actually help to improve people's physical activity? Now, when we're talking about physical activity monitoring tools, there are actually a number of things available on the market. So there are a lot of websites and applications which you can download for free to monitor physical activity. One of the most popular application is MyFitnessPal. I'm sure many of you are using it yourself or using it with, or your patients are using it. So it has quite a comprehensive program that allow people to track and record their physical activity level, and also pairing with physical activity trackers, which they can then record their activity without needing to go onto the website and record the type of things that they do. Pedometer is quite popular and also inexpensive. Heart rate monitors are used probably in the earlier days to monitor physical activity. And of course, nowadays what is popular is the accelerometer type of wearable devices, which includes fitness trackers and smartwatches. We do quite a bit of research in using fitness trackers, so I'll talk a little bit more about this type of devices. So fitness trackers, there's a variety of companies that are making them, and mainly they help to monitor physical activity in free living environment. Some of them can be worn at the wrist, some of them are around the waist, and some of them can be just clip on to your clothing. Typically, they sample, they're accelerometers, so they can sample the body movement in a vertical plane, so when you're going up and down, anterior, posterior, so when the body is swaying forward or backwards, or medial, lateral, so when the body is swaying from side to side. So we collect all these information at a rate about 10 to 30 times per second. Most of these trackers also track sleep quality, and they have their own application from the company that make the trackers that you can log your food intake and caloric intake. So it provides a comprehensive picture of the person's lifestyle. Other types of trackers also comes with applications that has GPS devices, so it can report more or track more accurately the distance that's being walked. And it also, many of them have social media function, whereby people can then connect with people who, their friends or people with similar conditions to share successes and encourage each other to be active. I was often asked to provide advice about what type of trackers, should I get a fitness band? Should I get a smartwatch? What is useful? Which one is better? So I think I can group those questions in 5 main ones that are being shown here. So first of all, I think which wearable devices to get, it really depends on the person's needs. Whether the individual is using those devices to track their physical activity casually, or they really wanted to give good information about their physical activity. So people who are really serious about using that information to give feedback about their physical fitness. So smartwatches, although smartwatch has a lot of functions, it's actually not as good in terms of tracking physical activities, because the parameters they take in usually much more limited as compared to fitness bands. So both fitness bands and smartwatches track steps, distance walk, and so on. But fitness trackers usually take more details, such as sleep quality. It takes in information about the individual characteristics into their algorithm, so that it can calculate the activity level a little bit more accurately than what fitness watches are able to provide. It also depends on what people want in terms of goal setting. Some of the fitness trackers have more elaborate setup for people to set their activity goals. FitBit, for example, can track your activity goals, track your goals, or people can set goals about this the number of hours to sleep, their food intake. So there are more functions allow people to track and get feedback about their lifestyle choices. Smartwatches usually a little bit more limited in that area. The other thing that I would ask people to think about is that, are you getting those devices for utility or fashion? So that it may not seem to be an important question, but for the users, that is something that they may want to think about. Smartwatches is a fashion statement first, tracking tool second. So if someone wants to use that as a way to to look good, that is fine to get a smartwatch. And fitness band, on the other hand, oftentimes is made in a way that when you wear it, they want people to forget about they're actually wearing that kind of trackers. So they're made in the way that it's sort of blend in with clothing and so on. So again, it depends on what people want and their preferences when they're thinking about what device to purchase. The second question is that, how accurate are these measures? So many of these devices are developed specifically for people to track sort of the moderate to activity area and trying to encourage individuals to push a little bit further. So there are a number of studies that are looking at whether these commercially available devices are actually accurate in measuring what they report to the users. So one example is FitBit. There are a number of studies out there, and here is an example that I'd like to show you from Dr. Michael Hunt's lab at UBC, and the study was done by his PhD student, Judy Takis. So what they did was to use one of the FitBit 1 devices, which is a clip-on accelerometer, and the device is usually used on the dominant side of the hip. And so they had participants to wear 3 FitBit devices. One is on the dominant, clip-on on the dominant side, the second one on the non-dominant hip, and the third one inside the pockets of the pants. And then they asked individuals to walk on a treadmill, which has been calibrated to show accurate distances travel, and then they have a student to actually count the number of steps that individuals were walking. And what they did was to look at how accurate Fitbit is recording in terms of the number of steps and the distances walked of these individuals. So in the slide, you can see that the two diagrams. The top one shows the errors that's recorded from the Fitbit devices in terms of the step count, and the bottom one is for the distances. So on the x-axis at the bottom shows the 5 different speeds that individuals were asked to walk. The slowest speed is about 0.9 meters per second, which is a very, very slow speed. And then the top speed is at the level of purposeful walking. The y-axis shows the percentage relative error for step count on the top graph, and for the top graph shows the distance. So what they found was that it doesn't matter where you place the Fitbit tracker in this particular study, that and regardless of the speed that the person was walking, the error for step count was pretty low. So Fitbit is pretty good in terms of picking up the steps, and if you use it as a pedometer for step count, it's very good. But when it comes to the distance travel, the slower the individual is walking, the more errors it picked up. And what they found was that Fitbit tends to overestimate the distance walked by the person when they're walking very, very slowly. Now that is important because in patients with chronic diseases, especially with chronic pain, sometimes we tend to walk a little bit slower. And if they're using a device like the Fitbit One to give them feedback about how far they walk in a day, they may get an inaccurate piece of information saying that they're walking more than they actually did. There has been studies looking at individuals with chronic diseases like chronic lung disease and people recovering from stroke. And we're talking about the average speed of walking for these individuals is somewhere between 0.5 to 1.1 meters per second. And I could not find any information for people with arthritis or specifically with chronic pain, but I would imagine that it would be around that area. So we're talking about individuals who are walking at a speed at the low end. And if you use the Fitbit as a pedometer for the step count, it's not a bad idea. But if people are relying on that device to give them information about how far they walk, they may get something that's much better than or higher than what they actually have performed. Another study that we did was with Fitbit Flex, which is the one that is worn around the wrist. And we used that to compare with a research-based accelerometer called the SenseWear, which is an armband that wear around the back of the upper arm. So Lynn Feehan, former postdoctoral fellow, did this study with 10 people with rheumatoid arthritis, and what she found was that the Fitbit Flex was not bad in terms of capturing the number of minutes people spend in moderate to vigorous activity compared to the SenseWear, which we know is very accurate in capturing that information. However, when you look at the sedentary time and the light activity time, Fitbit tends to over-report the amount of time of people spent in sedentary activity and under-report the time that people spend in light activity. So what it means is that if we're using Fitbit and use the Fitbit results to counsel people about reducing their sedentary behavior, people may not actually get the right feedback that they were doing the right thing. So even if they start shifting some of the sedentary time into light activity time, the Fitbit may not be able to pick it up. So that's something should be taken into consideration when recommending to patients about using these devices to provide information and support for the physical activity. The third question that I encourage people to ask is about how the company treat their personal physical activity information. So every company online will have their privacy policy, and I know it is long to read, and sometimes it's not the easiest thing to read, but I think if we're thinking about encouraging people to use these devices to as a part of managing their health, understanding where the data are going to and how the company treat the personal data and how safe the environment is in terms of storing the data, it is important. Fourth question is a practical question. So how often do I have to recharge the battery? And I think the question is, it really depends on the function that's offered by the devices. Usually, when a device do more things, has more functions, the battery life is shorter. That's common sense. Some of the devices use a backlit light. So those devices usually use more batteries and need to be recharged more often. FitBit, for example, and a lot of the commercially available wearable devices allow the user to synchronize their information through Bluetooth, and that uses a lot of battery. So FitBit, for example, usually lasts about 4 to 5 days. It depends on how often you synchronize the information. There is a company called Garmin, some of you may be familiar with it, that has a different type of setup that they use a battery-sized watch, a watch-sized battery that can actually last up to a year. But the presentation of the information on the device is not as attractive, and in order to synchronize the information online, you need to actually take a couple more steps to do that instead of doing it through Bluetooth. And smartwatches, because there's a lot of different functions, it actually needs to be recharged daily, oftentimes. So it depends on how much the person find it acceptable in terms of recharge the battery, and they can decide what device that they would like to get. The last question is that if they get a device, can their health professional actually help them to interpret the results? And I think that is a practical question for patients. Some of the devices, like FitBit, comes with a dashboard and application that has an interface that is easy to interpret. So those are great. But some of the other devices may have a more complex layout for the activity information that it may take some time for health professionals to make sense out of. And those are the ones that may present a barrier in and of itself if you are using it for as a part of managing the condition. So there are a number of different activity trackers out there, and I think I mentioned earlier that a lot of them do very similar things. So here are some of the examples from FitBit, and most of them will collect information about your steps and distances, your caloric output. Most of them have a mobile application. They have a goal setting function, which is great, and it allows for the opportunity to give feedback to people and encouragement for people when they meet their goals. A lot of them have sleep trackers, and they're waterproof, but you cannot really wear it in the shower or go swimming with it. Now, the only thing that is different across those three devices is that the Fitbit 1, which was the one that was clip-on to the clothing, and the Fitbit Charge have an altimeter, so it actually measured the floors that stair climbing, which is additional information that people may appreciate. And but the Fitbit Charge is the only one that has a heart rate sensor that can collect that information, which makes the output a little bit more accurate. Jawbone also have two different models. Again, it does a lot of the things that Fitbit would do, except that the more the higher model, the Jawbone Up 3, also has an altimeter to measure floors climbed and also the heart rate monitor. Garmin is the one that uh, probably a little bit newer type of products, and it also has an altimeter, and it's the only one on our list that you can actually wear in the shower and when you go swimming. On the company's website, it says that the Vivo 3 is good for going to about 50 meters deep in water. So again, many of the similar functions, but a couple of features that are different for users to consider. There's not a lot of literature about barriers to using these type of physical activity monitoring tools in arthritis, but in diabetes, there are certain things that some of the studies have identified barriers from the clinician's perspective and patient's perspective about using these tools. From the clinician's perspective, the major concern is around data security and about measurement accuracy. From the patient's perspective, what they worry about is whether these tools are user-friendly or not, and also whether the tool match what they need to do. So some of the tools, for example, require individuals to enter information on a regular basis. Those are the ones that people find it hard to adhere to over time, especially when they're managing well with the disease. And what people don't want is to keep going back and report very similar information about their activity, about their symptoms, and so on. So that is one concern that patient has raised in terms of these types of tools. Now, so our team recently completed a study that looked at arthritis care using digital media tools, in particular using physical activity monitoring tools for self-management. And we want to understand a little bit about the concerns from health professionals' perspective as well as patients' perspective. We did focus group in BC, Alberta, and Ontario, and in both rural and urban communities, and included people who self-report as novices as well as experts in using these type of tools. So we have a broad scope of opinions. 40 patients participated and 25 health professionals from those 3 provinces participated in our project. So what I'd like to do is to share with you some of the key themes from the 2 different perspectives. The concerns are actually surrounding 3 major things. The sustainability of these type of tools and the sustainability of being physically active was one of the concerns that's raised by both parties. Motivation and responsibilities are also the main topics of discussion. The results were actually presented at American College of Rheumatology meeting by Graham McDonald and Jenny Lees, who are trainees and staff on our team. So, sustainability. From the therapist perspective, many therapists see that these type of tool, they're thinking that they may be just a novelty item. There were some concerns about the cost of purchasing those type of devices and also the uptake of these type of tools, especially if people are already active. Therapists talked about, why would people actually need to use these type of tools if they're already active and if they're already motivated. They were also concerned about the accessibility of these type of tools, especially for people who may not be computer savvy or they have a certain type of health concerns that may act as a barrier. For example, people with poor vision. is it easy, is it feasible for them to use some of these applications on a smartphone, for example, or for people with hand problem with arthritis, whether it is easy enough for them to navigate some of these tools when you have severe hand pain, for example. From the patient's perspective, they also concerned that these type of tools may be just a novelty item, but what they were thinking was a little bit different. If I have a flare-up, even with those tools, can I get the health professionals to help me through the period of a flare-up so that I can maintain my physical activity safely? So the tools may be nice to have, but it's almost irrelevant when someone is having a flare-up. The other concern that individuals were talking about was the user-friendliness. Some of the interfaces may not be as intuitive for users, so those are the ones that are not as helpful for patients. The second theme is about motivation. From the therapist's perspective, they sort of perceive that these physical activity trackers sometimes may act as a possibility for barriers to the traditional therapeutic relationships. What they were saying was that there is really no replacement from for people to actually get the guidance from therapists themselves, and the tool alone is not enough. So so there is the perception that individuals can take the tool using these wearable devices and monitor their physical activity over a period of time independently. But therapists wonder whether that is something that actually can be sort of damage the therapeutic relationship in which that people may not talk to their therapist when they and get specific feedback. So therapists also see that these sort of tools can help to act as a reminder, extra reminders, to help people to keep on track with the exercise. So it can be used for people if they started off with a lower motivation to be active. Now, from the patient's perspective, it was quite interesting. While they agree that these type of devices is no replacement for internal motivation from the individual, they also think that these type of tools are likely only be useful only for people who already are physically active. So that these tools would be, they see these type of tools as useful as a reinforcement to push people to go a little bit further. But for people who are not motivated to start being physically active, many of our participants see that they're probably not even the right tools to start for people, to encourage people to be active. They felt that something else would need to be done during the therapy session in the therapeutic relationship to help people to get started first, and perhaps adding the wearable devices later as something that once they get more motivated to be active. The third theme is about responsibilities. From the therapist's perspective, they welcome the use of these type of devices because they perceive it as giving patients more ability and also the accountability to be active through getting information, the objective information about their activity performance. However, the discussion in the focus group showed that therapists sort of divided about whether these tools can help to streamline the therapeutic session or it disrupt the session, because these devices provide so much information. And while some therapists see that it's useful to use that to guide the discussion about physical activity during their therapy sessions, others find it a little bit disruptive that you have to go through so much information that some may be to decide what is relevant and what is relevant to guide the treatment recommendations. From the patient's perspective, they generally felt positive about sharing information with physical activity information with health professionals. However, they were not sure whether health professionals will actually use that information in recommending treatment simply because of the time constraint. So I think that our finding echoes the previous finding from diabetes regarding the concerns about user-friendliness. And at the same time, we find new viewpoints about how therapists and patients consider the motivational benefits of these tools. And I think that the differences in point of views explains why there's excitement in the healthcare community in finding ways to incorporate these tools in patient self-management, but also skepticism about sort of the perceived usefulness and the expectation of what these tools can offer. Our finding also echoes the results from one of the recent studies from Elizabeth Lyons from University of Texas. What they did was to analyze 13 different activity trackers against 93 behavior change techniques, and they found that although these devices draw on techniques like self-monitoring, feedback, goal setting, etc., to serve as a motivation, they also seldom use some of the very effective techniques to change behavior, such as getting people to practice the actual tasks, action planning, and problem solving. And many of these higher level motivational techniques require the guidance from a health professional or fitness professional with skills in motivational techniques and an understanding about the feature and utility of these tools. So in our team, what we're trying to do is to gather this information and develop a new intervention that we're currently testing and see if it helps to counsel people with arthritis to be physically active. It involves the use of a FitBit as well as education from a physiotherapist about being physically active and setting goals. And there was a period of counseling of the therapist done by telephone and email to support people to get into a physical activity routine and to reduce sedentary behavior over time. So hopefully I'll have a chance to present the result to you when the studies are done. Right now we're recruiting people with osteoarthritis in the knees, and the study will be expanded to people with rheumatoid arthritis and lupus in the next few months. So in summary, lots of tools out there. A lot of them have similar functions, and I think patient preferences will dictate the choice of the devices. I also think that successful implementation of these wearables in arthritis care and chronic disease management need a collaborative effort between patients and health professionals, and further understanding and actions are needed to address some of the concerns raised by patients and health professionals regarding the use of wearables and digital media devices in arthritis and chronic disease management. I'd like to close by thanking a lot of people that I work with, especially the patient partners who gave us a lot of feedback about how to structure these type of interventions, and without whom our studies cannot be done. And for those of you who have questions and are interested in our project, here's my contact information. I'm going to stop here and thank you for your attention.
Wonderful. Thank you very much, Linda. That was a fantastic presentation, and we would love to do a webinar with you when you do have results from that research that you're doing right now, that you're recruiting for. And I will also include links. Do you have the information for recruitment for the studies up on your website?
We certainly do.
Okay, I will link to that so that people can access it should they be interested as well.